cloud. Okay.
Oh, got it.
Did I get it? Okay.
Yeah.
Good.
Yes.
All right. So thank you, Jasmine. Oh my gosh,
You're
that's
welcome.
amazing. All right. Okay, so then the albumins, they're produced by the liver and they contribute to the osmotic pressure. You can see it a lot in liver failure when someone is going through that. They'll have swollen ankles, swollen body, their stomach will be swollen. It's also, there's a couple of things that contribute to it, like lack of protein to synthesize the albumins can also cause the ascites, and the osmotic pressure will be unbalanced. That's why there's a whole bunch of reasons why this can happen, but that's one of them. Oh, goodness. Okay. All right, so globulins, she only talked about one, which is gamma. She didn't really care about the other ones, but she said that she wanted to put this here so that you would know that there's other ones. And they just transferred lipids and fats. But I don't think she's ever going to ask a question about this because there's so much content that she is going to ask questions on. Gamma globulins produce antibodies and are antibodies, and they're produced. They are antibodies. Yeah, they are antibodies, and they're produced by the lymphocytes, like B and T cells, right? B lymphocytes and T lymphocytes, I believe. And fibrogen, it's about 4% of the plasma of it. And fibrogen is the precursor to fibrin. So when you have a blood clot, then it converts to fibrin to assist in clot formation. I do not know where to put this. All right. All right, so this is what we were talking about before with her, is that the plasma volume, right? When we don't have enough water, like we don't have enough water in our blood, right? We're really low. Our body will release this hormone called ADH, which is antidiuretic hormone. And this basically stops the kidneys from excreting water from the blood and keeps it absorbed. And it also makes
Is my hair like Jerry? He's itching.
all right. And formed elements, right, is the erythrocytes, and they, they're flat by biconjugate disc, like this Oreo here, okay? And like we talked about before, they have a 120-day lifespan. One of the reasons for that is because they're anucleated, so that they can't perform they can't do cell division, they can't synthesize DNA, all that stuff, right? So they can't do that, so they can't, separate and split off and become two different cells. And that's not exactly how they do it. And they have no mitochondria because, that they would take in the oxygen themselves instead of transporting it into the different tissues around the body. And the spleen, the liver, and bone marrow remove the aged cells. And yeah, this is just a set of the picture of the red blood cells. And I'm pretty sure those are platelets. I don't know. Does anyone know? No one? I don't know. Anyways, it's just a picture of red blood cells. Hemoglobin, okay, so this is what I was talking about before, that red blood cells are composed of hemoglobin, and each hemoglobin has about 280 million hemoglobin molecules, which is freaking crazy. Oh my gosh, that's insane. I didn't know that. Okay, I don't think we need to know that. She didn't really talk about this either. Only the most important part is that hemoglobin has iron in the middle of it, and this binds oxygen because iron is +2 and oxygen is -2, and that's what binds the oxygen or carbon dioxide to the red blood cell to take it to wherever it needs to go, whether it's the lungs or the tissues or the wherever it needs to go. And the heme is what is, the color, and iron is also recycled from old red blood cells. And I don't think we need to know this, but you do need to ingest iron small, like not a lot, but it's essential, right? Or people have iron deficiency anemia, which can happen a lot. I feel like, I don't know. I'm not a doctor, but when you think about it, right? When you think about iron deficiency and like it happens a lot to women, you know, when we have our periods and such of this, it, you know, it's like bleeding, right? And the iron is recycled from old cells. And but if we're bleeding, right, we're constantly over like 3 to 5 day period or even longer, basically excreting the red blood cells, right? And this can be, you know, obviously it can't reabsorb the iron, so you're losing all that iron. So I think, I mean, like maybe that might be why women are more prone to have anemia, but you know, of iron deficiency. We don't know. I don't know. I'm not a doctor, but I mean, you can kind of figure that that was probably one reason, maybe. Okay, this is just showing you a picture of what hemoglobin looks like, and this is the heme, and then this is little dot in the middle is iron. Okay, so anemia is low hematocrit hemoglobin or RBC, blood loss, right? Like when we're bleeding for 5 days. Thanks God. Anyways, uh, the symptoms, like we talked about, weakness, tiredness. You know, you guys, we get dizzy when we stand up. Not like I have it, but like I know people get really dizzy and like then they see like the world sideways. It's crazy. It can also be from insufficient B12. That's pernicious. Oh gosh, when I don't read it, pernicious anemia, which is insufficient B12, and it's usually a lack of intrinsic factor, which you know has to do with the parietal cells in the stomach, right? All that stuff, and funness. But we don't need to know that anymore. It's all gone. It's like poof, goodbye. And aplastic anemia is destruction of bone marrow. Like when a person has cancer and they're getting chemotherapy, this could be one thing that happens. Which the destruction of bone marrow has a big part in synthesis of red blood cells. So you can kind of see that if you cannot synthesize new red blood cells via the bone marrow, then this would lead to low hematocrit. Polycythemia, what we talked about before, was elevated red blood cells, and this could lead to viscosity issues. And there's many reasons why your hematocrit can be higher, like elevation, and there's like a whole different set of reasons, which we're going to go into because I'm almost certain that she's going to ask a question about that on the test. All right, so this is sickle cell anemia and how it's a genetic disease where they cannot synthesize hemoglobin correctly, or you know, and then they get these sickle cell looking red blood cells, which don't function very well in carrying oxygen because they look like they don't have a disc shape and they're kind of like, you know, they're weak. They look weak anyways, but let's see. Okay, so white blood cell or oh wow, when you move it to a place where you can't see the rest of the screen. Okay. Leukocytes, they can't contain nuclei, mitochondria, and are motile. Diabasis, what is diabasis?
They squeeze through the capillaries.
The capillary walls, right? And that would make sense because, you know, white blood cells, if let's just say we cut on a door or something, then I don't know why you'd cut yourself on a door, but you know, hey. Anyways, so you do, and these white blood cells will squeeze through the capillary walls so that they can eventually do this function, which is extravasation. Extravasation. I don't know. It just means it's an exit from the vascular system into the tissues. Okay, so diabasis is when these little white blood cells are squeezing through the capillary walls, and it could also be functioning in red blood cells because you can say that they do the same thing. And then extravasation is only a function of white blood cells because they're exiting from the vascular system and entering into the tissues so that they can clot, right? They can clot whatever whatever's happening, like if there's an infection or anything like that, or like if, let's just say I hit my leg really hard, and even though it didn't break skin, I still have a bruise, right? It's like bleeding and all that stuff. It's so fun. But I think, like, wouldn't it open up blood vessels too? It would do that as well, right? But it could also be like, I don't know. Well, anyways, it's white blood cells do that. They yeah, anyways. Okay, so there's two broad categories of white blood cells, and what are they?
Granulocyte and agranulocyte.
I think the difference is because one has granules if you look on a telescope, oh my gosh, on a microscope, and the other one does not. So the granulocytes are the fills, okay? You got basophil, you got erythrophil, and you got neutrophils, okay? And they all do different functions. What is the most prevalent granulocyte?
The neutrophils.
Perfect, the neutrophils. And neutrophils, what do they do?
They fight off infections.
Perfect. Yes, they fight off infections. Exactly what I wanted to hear. Anyways, so granulocytes. What's the most prevalent granulocyte? Lymphocytes or monocytes? There's a typo there. If anyone sees that, I see it.
Lymphocytes.
Lymphocytes.
Perfect. Lymphocytes. And lymphocytes, they have two different ones. What are the two different ones?
T cells and B cells.
Perfect. T cells and B cells. And T cells do what? I don't remember.
They kill pathogens.
T cells kill pathogens, and B cells
make antibodies.
Make antibodies. I need
from
to
the plasma. They produce plasma. That's what she said in the lecture.
Okay. Well, I'll go back and watch this, and then I'll write it down because I cannot find a pen anywhere near me. Anyway, okay. All right. So this is just showing you what diaphysis is doing, where it's going, not diaphysis, sorry, extravasation, where it's going through the capillary walls into the tissues. She said we don't need to know this, so I don't know, but it's pretty, I mean, like, I can look at it and remember, like, which one is it, and pretty much like that. But this is a erythrocyte. It's down there, if you can see it. And platelets are little weird, little blobby things that clot things, if you wanted to know. This is just showing you a picture of it, and like how males have this hematocrit and females have this hematocrit, which is normal, you know, for males and females respectively. And you can always tell that which one's male or females, because females always have lower for most part. You know, like they'll have lower numbers because they don't have as much, they're not as tall, I'm guessing, and they're not as like big. But like, who knows? Like maybe maybe I don't even know. But I guess if they were hunters, like women were, I don't know. We don't know. We try. Okay. So just talking about what we did before, the neutrophils are the most abundant. What are the immature neutrophils?
It says band cells.
It is band cells. Whoa, that's crazy, right? Yeah, it's band cells, and we don't need to know anything about that. But the elevation of it often indicates infection. There's basophils, erythrophils, and those are all granulocytes. I know you're so excited. And then erythrophils are often elevated in parasitic infections. I don't think we need to know that either. It's just so fun. All right, so lymphocytes, they're the second most numerous. They're small cells, little, that doesn't really matter. They fight infection. They give rise to plasma cells, which are B lymphocytes, which produce antibodies. And they also produce T lymphocytes, which kill pathogens, I think. Yeah, I think that's what she said. And then monocytes, they're the monocytes are the ones that the macrophages, when they go into the, that's what that is. Anyways, where they eat things. They nom 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 nom. Anyways, so leukocytosis is elevated white blood cells, and leukopenia is reduced white blood cells, which she said that you'll see a lot in the medical field, which makes sense because, you know, if you have elevated white blood cells, what does that mean?
There is an infection going on somewhere.
Yep, and leukopenia, which means reduced white blood cells, could mean what? I don't know. Probably cancer. Could be cancer. I mean, I don't know. Somebody should look that up, actually. I'm going to look it up because I'm a nerd. I'm sorry. Okay, so it basically it's leukopenia could be like if you're undergoing chemotherapy, right? And you get when they, you know, like how people, it makes people more susceptible to infection. So like if you go through chemotherapy, it kind of destroys pretty much everything in your body, which is horrible for you, but you know, we don't know. Anyways, sometimes they think it's worse than the actual disease. Some people think it's better. We don't know. But it reduces the white blood cells, which can increase infection. And that's why they say, if you are taking this, blah, 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 please do not take this because it can increase your risk of infection. And that is probably why. Now, I'm not a doctor, but we can kind of think. Okay. Platelets, which are thrombocytes, and they go through a whole thing, and it's basically a fragment of a cell, which the fragment of the cell is called megakaryocytes, and they're formed in the bone marrow. These are anucleated, and they move because they need to get to the wound to bind it to make it stop bleeding. They have a lifespan of 5 to 9 days, and they're destroyed by the liver and spleen. I know, so exciting. So these are just like the little fragments of the cell. Blood clotting, or platelet function when blood clotting, they basically plug the vessels and clotting factor activation, which we get into a lot. And it stimulates vasoconstriction of the damaged cell, which I was talking about earlier when we were talking about like the temperature and stuff. But that doesn't really have anything to do with it. But basically, if you get a cut, it will constrict the blood vessels so that you don't bleed out, right? If it's just like pouring blood, right, because it's dilated, then, you know, you could bleed out, you know, or lose a lot of blood, right? So it constricts the blood vessels or the damaged blood vessels to reduce bleeding. All right, so this is just showing you what the platelets do as they adhere to the thing, you know, so much. Okay, so hematopoiesis, what is that?
It's the making of cells, like white blood cells, red blood cells.
Yes, so it's the formation of blood cells, and they're continuously developed, right? Because, you know, we lose so many a day, and like we make 500 billion cells a day, which when you think about it, 500 billion red blood cells, you know, then times that by 280 million hemoglobin per red blood cell. I mean, whoa, we're getting up there in the numbers. I don't even think there's a calculator that can go that high, but we don't know. It probably is super calculator. I mean, it probably, I don't know. I ramble. I'm sorry. All right. So they are continue to replace the liver and the fetus and the bone marrow of all types of blood cells and the lymphoid tissue and the white cells only in adults. So when you're a fetus, you make your red blood cells in the liver, and then when you grow up a little bit, then it's made in the bone marrow, and then in the lymphoid tissue when you're talking about the white blood cells in adults. Make about 500 billion a day. Leukopiosis is the white blood cell production. And which two classes of tissue does it involve?
Myeloid and lymphoid.
Perfect. Yep, the myeloid tissue and the lymphoid tissue, which was I was trying to remember earlier. if anybody remembers, I could not remember the other one. I remember the lymphoid, could not remember myeloid, but I remember that it was the bone marrow. So it's the red marrow, the long bones that make the white blood cells, and the lymphoid tissue in adults, right? You know, they make it. And Okay, so it was talking about totipotent cells. She talked about it a little bit. So what are totipotent cells? Like if we're talking about a person, is it in the adult life stage? Are we talking about a kid? Like which life stage are we talking about?
Like it's the committed. Is it committed? Like
She's a college age student, right? You know what you want to do, but you don't know exactly what you want to do, right? So totipotent cells are the blood stem cells, which means they've committed to blood. They're like, I really like the blood, I'm not going to go anywhere else, right? But they become different things. So they can give rise to different blood cell lineages, whether it be the myeloblasts, which become granulocytes, and then specialize even further to, whatever the into like, oh my gosh, the neutrophils, the basophils, or the erythrophils, like whatever those ones are. And then the lymphoblasts, specialize into the lymphocytes, and it could either be the B or the T, and the monoblasts become the monocytes. So totipotent cells are basically the cells that give rise to the blood precursor, and they could become different. They rise to become different cells in the blood, they could be like myeloblasts or lymphoblasts or monoblasts. Yeah, I don't know about this. She didn't talk about it at all, and I have no idea. Oh, wow. The productions of subtypes. Okay, so yeah, that basically just means that the subtypes that I was talking about, where the granulocytes could be either neutrophils, whatever, basophils, erythrophils, those are regulated by the cytokines, which are secreted by immune cells. Who knows, man? Those are that's crazy. I remember learning about that. I was like, oh, I don't even know. But she didn't really talk about it, so we're good. But she did talk about thrombopoietin, which stimulates platelet production. Okay, so that was one of the questions on the you know what I'm talking about. Anyways, so it's like the blood worksheet. And it's basically it just stimulates platelet production, which means it makes platelets happen, like however, in the bone marrow, right? That's where they're made, in the bone marrow. And then it's from megakaryocytes, right? And then they split off, and they're basically the segments of that. Useful for chemotherapy patients when bone marrow destruction happens, because they can't make the platelets, right? Because their bone marrow's being depleted. So then you make so that they don't bleed out, whenever you cut them, or bruises or anything like that. So uncommitted stem cell gives rise to committed cells. So she said that the only one we needed to know was this one. So let's all say it together, because we need to get it into our brain, right? Come on, everyone. I know it's cheesy. We're going to do it together, though. Everyone unmute. Well, if you can. All right. The proerythroblast, right? Say it.
Proerythroblast.
And then that becomes the
Basophil erythroblast.
Yep. And then that becomes
Erythroblast.
Erythroblast. And then that becomes the
Normal blast.
blast. And then that becomes the
Reticulocyte.
And then that becomes the
erythrocyte.
Erythrocyte.
All right, let's do it again. First one. It starts off as a
Proerythroblast.
proerythroblast, then it becomes a
Basophil erythroblast.
and then it becomes a
Erythroblast.
then a normal I spilled the beans. And then it becomes the
Normal blast.
Normal blast.
and then it becomes a
Reticulocyte.
and then it becomes the
Erythrocyte.
erythrocyte. Good. Okay.
Those names are difficult to pronounce, though.
Right? Right. But as you can see that before, right here, the normal blast, when it becomes a reticulocyte, that's when it loses its nuclei. And everything before the reticulocyte has blast in it. So like it's erythroblast, basophilic erythroblast, normal blast, and then reticulocyte, and then erythrocyte. I do not know why they named it this. Why couldn't they name it like, I don't know, something easier? But what I suggest is if you're having difficulty remembering, I would take that and I would write it down a couple times just so that you can get it in your head, you know, and like before the test you can look at it and be like, okay, this is what it meant, and like re-jog your memory. And this is what I was talking about, the monoblast, the myeloblast, the lymphoblast, and the megakaryoblast, which produces the what? The platelets, right? Platelets, when platelets function in what?
It's clotting.
Clotting. Good. All right. So this is what I was talking about. So erythropoiesis is what?
The production of red blood cells.
Yeah. And it is regulated by erythropoietin, and it's secreted by the kidneys in response to hypoxia, which hypoxia means what?
Isn't it shortness of breath?
No
Right?
oxygen.
Yes.
Or
Yes.
oxygen. Yeah.
It's basically that you're not getting enough oxygen to your tissues. Basically, and in most people, you can look pale or blue, right? Depending on what, you know, how severe, right? It could cause cyanosis if it's really severe, obviously, but that's why your blood will kick in, right? And it will basically cause the production of red blood cells, and red blood cells do what? They carry oxygen to your tissues. And you could think that anemia, one of the things, because it's a lack of hemoglobin or red blood cells, depending on what we're talking about, right? That in this fact, right, it doesn't carry oxygen to your tissues as well because there's less of them, so they can't do it as well. So that's kind of like where we're going. But the regulated by erythropoietin, which is a question, so definitely remember that. I think that everything in red is pretty much really important. She does highlight that. She like makes that pretty evident. Excreted by kidney in response to hypoxia. And a couple things that could cause this production would be blood loss, right? If you're losing blood, then it's going to cause the production of more red blood cells. And high altitudes, right? She talked about like altitude sickness and how like for a couple weeks you're going to feel like really dizzy and tired because you're just not used to those high altitudes. In certain lung disorders, and when I talked about like how it basically the system will overcompensate if it feels like you are not getting enough oxygen, it could be a fault of your lungs, you know, not necessarily your you know, your red blood cells, right? And strenuous exercise, and this is the same thing. When you're doing strenuous exercise for like first couple times, right, you can't breathe as well because your cardiovascular fitness isn't really good. So like you're kind of overcompensating, and this is one way that you can stimulate the erythropoietin that's secreted by the kidney, right? That produces these red blood cells to kind of take it up a notch and get the oxygen to your skeletal muscle, to the rest of your body, so that you can, you know, live. You know, it's pretty good. Okay. And some, you know, basically when it's done too much, like in like lung disorders, right, it's in emphysema especially, it causes polycythemia, which is only in severe quick cases, and this makes the blood thick, which makes it harder for the blood to the heart to pump blood. And that's because, you know, your lungs aren't sufficiently basically using the alveoli to like give oxygen and diffusion through that exchange, so you don't have any oxygen to get to the muscles. So you're basically, your blood is kind of like, I don't know, I'm doing my job, but like I'm like Fred over there, he's not doing his, like the lungs, no, he's just not doing his. So, and it keeps doing it. So not good. and it will keep producing more and more and more to overcompensate. Okay, I hope I made some type of sense there. Okay, so this is talking about our like little chart there. So let's talk about it again. So erythropoietin binds receptors on the
Proerythroblast.
proerythroblast, and the proerythroblast becomes the, I can go back to my chart.
The basophilic erythroblast.
And then from there, it becomes the
Erythroblast.
and then they differentiate into,
The normal blast.
and then they lose their nuclei, and they become
The reticulocytes.
reticulocyte. And then from there, they become the,
Erythroblast.
think about it.
Right.
Yeah,
Erythrocytes.
good. All right, so reticulocytes leave marrow, right? And they differentiate into red blood cells in the blood, and elevated reticulocytes are indicative of recent blood loss. She didn't really talk about that, but I mean, you could kind of say that it could be, because it would be elevated reticulocytes and also elevated erythrocytes. I don't know. We don't know. We don't know. We tried. Okay. This is in the worst possible place. Okay. So reticulocytes are released into after this, and erythrocytes are released into the blood. And this is all in the bone tissue, the bone marrow, or the myeloid tissue. And it stimulated the proerythroblast by erythropoietin, which is made by the
Is it by the kidneys?
yes, it's by the kidneys in a response to what?
Hypoxia. Hypoxia.
All right, and you can kind of see that this would be a stem cell. It's called a hemocytoblast. So, I mean, like it has blood in the name. She didn't really talk about it, but if you like saw it in the test, you're like, I have no idea what to pick. If it has hemo in it, you're like, you could be like 20% right, 25% right? There's only 4. Anyways, it was a joke. Everyone needs me. Anyways, all right, let's go to the next one. Oh, it's the end of slideshow. Woohoo! We made it through one. Does anybody have any questions?
No. For now, no. Yeah, no.
No.
All right, we're good. All right, let's go to the next one. I know this, oh gosh, you don't need to see all that. That's scary. Scary stuff, y'all are like, I don't know what that means. Looks scary. It's very scary. All right. Okay, so this is the same. Wow. Okay. Wow. This is the same slide, and basically it's just explaining the same thing. So this is talking about the blood types, and the important thing to talk about here is that different blood types, right? You have A, B, and O, and they have different types of antigens which are located on the whatever blood type you have, and the antigens have certain, or the blood has certain antibodies to protect the host from receiving any other blood type. We don't know, but it's protecting us, right? And when you, like, if I had A blood and you put your B blood in my A blood, then my anti-B antibodies are going to come for you, right? Because they don't like you. It's like, get out of me, okay? Like, I don't want your blood, all right? So in this, the antigen detection results in the antibody production, and that is by the B lymphocytes. Did I get it right? My gosh, I feel like I learned something. Okay. and the red blood cells express these surface antigens, and depending on your blood type is what antigen is your blood. Like I'm O, so I have no antigens on my surface of my red blood cells, and if Diana here has AB, then she has both. I'm sorry I called you out. She's like, I'm just a senior, bro. Like, it's not, don't call me out like that. And if she has AB blood, right, she has A and B antigens on the surface of her red blood cells. And she would, so for me, I have both anti-A and anti-B antibodies in my blood, and she has no antibodies in her blood, unless we're talking like the Rh, but we're not talking about that yet. We're just talking about this specific thing, so we don't get confused. All right. And apparently they're glycoprotein, whatever this is. We didn't talk about that. I will not get you. I don't care. I do not know. I could not tell you anything about that. But this is what I was explaining about the type A, type B, AB, and type O. So right here, the surface antigen. I'm sorry. Oh, crap. The paper was posted, guys. If you guys want to see it. All right. What do y'all get? You guys do good?
Yeah.
All right. Okay. So this was just explaining that, sorry. And anti-B antibodies would be present in type A blood, as well as type B blood would be surface antigen B, and it would anti-A antibodies in that blood. And then surface A and B would be type B, A and B, and they would have neither anti-A or anti-B antibodies, and type O would have no antigens on its surface, and it would have anti-A and anti-B antibodies. Okay, and what happens, which this chart down here says it. So surface antigens is potency antigens. Like let's just say that I'm A blood and you give me B blood, my antibodies will come and attack that blood, and agglutination or clumping will happen, and then lysis will happen, and this will cause the hemoglobin to be dispersed into the freely, like cut down hemoglobin, and then this could clog the renal tubules, and this could cause death, right? Because kidney failure, which is an important function of our body. So is not very good. So that's why they have cross-checking and everything, and like everybody, this is not functioning very well. Okay, and this has been interesting. Yes.
So can we just go back to the previous slide because I can't say the word. That word, agglutination. So that only happens when there's a mixture of, like, you get the wrong blood type, right? That only happens.
Mm-hmm.
Oh, okay. That was it. That was my question.
Yeah, it can happen if you get the wrong blood type, or if you get like, it's kind of complicated, but if like let's just say I was negative and I get positive blood, that would also be a cause for it too. But that's kind of complicated too. I mean, even it would have to happen. It's complicated, but yes, exposure to other blood is what causes it. That's not your, or that's not your type. Oh wow, can you just, okay, there we go. All right. Determined by presence or absence. Antibodies appear in plasma 2 to 8 months after birth. We don't know. I mean, we don't know. whatever. I don't know. She didn't talk about that. I don't know exactly what that means either. So this is just showing you like what blood produces what antibodies, basically. So when she talked about universal donor and universal recipient, it's not really true, because the fact of the matter is when you give someone else's blood, that regardless of whether the cells have specific antigens on them, it's more so that the other person's blood has antibodies that react with your blood. Like, for example, if I have an A positive patient and I give her O negative blood, the antibodies in the O negative blood will react with her antigens on her cells. So because I have anti-A and anti-B antigens or antibodies in the O negative blood, those anti-A will attack her antigen or her blood cells. You get what I mean? So it's not like 100% true, right? And for the universal recipient, it's vice versa, right? They have no antibodies, or well, they have antigens on their. It's complicated, but basically it's not like always universal, and they try not to do it as much as possible because there's antibodies in the blood that can respond to the other's antigens on the blood cells, whether it be the recipients or the donors. Agglutination, so it just means the clumping, which attach several RBCs at once, and when they attach, then basically they'll come. I can't even remember what comes and kills it, like what comes. So the complement will come and like kill it basically, or kill the red blood cells that are like basically bad or not welcome. And when they come, then the complement destroys them, then the hemoglobin's free in the bloodstream, which can clog the renal tubules and basically could cause renal failure or kidney failure. And this is just showing you what happens, that the antibodies come and bind the red blood cells, and then the complement comes and kills or destroys the red blood cells. Complement kind of looks like broccoli and cheese. Does anyone see that? Kind of does. Anyways. All right. Mismatched blood leads to transfusion reaction. Donor blood is agglutinated by recipient ABS. So this is basically just talking about exactly what I was talking about. The ABS, when she talks about ABS, she means antibodies. The agglutinated RBCs block small vessels, and donor cells lysis, and hemoglobin is released. And then hemoglobin can block the kidney tubules and result from death from renal failure within a week. That's not very good. It's horrible. It's discouraged in practice, but it can be done in small amounts in emergencies. And it's because the plasma contains the antibodies that can react to the antigens on the other person's red blood cells. So this is just saying an example. Give O to A. Recipient doesn't recognize it's foreign, but O plasma has antibodies to both A and B and can react to A. So the Rh blood group is determined by 3 genes, which we don't need to know. Anyone with D or higher, these D antigens on her red blood cells are classified as Rh positive, and Rh negative individuals lack the D antigen. Typing is tested using anti-D antibodies, right, to see if it agglutinates. O positive means type O, and Rh positive, which means it does have this antigen on its red blood cell. And most people are Rh positive. There's not a lot of, because it's the dominant trait. So this is talking about what happens when basically they're exposed to, well, basically, so let's just say I'm O negative, okay? And I have a baby with an O positive person, okay? And whatever, I get pregnant. The first baby is not a problem because our blood, me and the babies have not been mixed yet. So your blood, until you get a transfusion, or basically until you're exposed to the D antigen, you're not going to develop antibodies until afterwards. That's why it's not a problem till the next pregnancy. Because once you have the baby, then when you're giving birth, right, then your blood's going to mix, through birthing. So after that, then your body will develop anti-D antibodies, or I would, because I'm O negative, and then you give birth, and the next baby that you would have, your blood cells would attack their blood cells and cause like a severe anemia possibly, or something like a whole bunch of stuff. And it could cause, it could be jaundice, right? Because the destruction of the red blood cells is so severe, and a whole bunch of stuff. And there's a thing called RhoGAM, which is given prior to birth, and it basically protects the baby from, it like kind of like hides the baby's red blood cells from the mother. So right here it says it binds fetal antigens to like hide the fact that it's O positive. And she also said that it has been shown that some other different blood types and such do the same thing, but it's not as prevalent as specifically positive and negative Rh groups. Everyone understand that? Did I make that more confusing? Everyone got that? No? Yes? Hopefully. All right. So this is just showing you, good. This is just showing you exactly what I was talking about, how it will attack it, and it's not good, and basically the same thing. All right. So let's see. Where did we stop? We stopped here. Where is it? In the PowerPoint, we stopped here, but let's talk about it because, well, we're going to speed up here in about this time. So hemostasis is essential to life, which just means the clotting factors, and exposed collagen initiates, which just means it's exposed, like if I cut myself, exposed collagen, which is what makes up your skin and all the stuff, initiates the vasoconstriction, right? What I talked about before, which is where the vessels constrict so that you don't have as much blood flowing through that vein or artery or whatever. Platelet plug formation, like those platelets will plug it so that it stop bleeding, and then fibrin meshwork surrounds the plug. Okay, so there's a lot of steps that go into this, but these are the three main steps, okay? And platelets are repelled from the walls and each other in smooth vessels, undamaged. Important that inappropriate clot formation is as bad as no clot formation, because it can clog blood vessels. Like how myocardial infractions happen and all that stuff, where clots can go through and clog the artery, and then this cause like a whole bunch of necrosis, death obviously, and all this stuff. So it can be very bad. So this is just showing you like what it looks like. These are the platelets, and then this is the fibrin meshwork. So these are the hemostatic mechanisms. So right here, vascular spasm means that it vasoconstricts the blood vessel. This is the platelet plug formation right here, which the collagen fibers are exposed, so they plug it really fast, and then the blood clotting, which is the fibrin, basically form this meshwork to stop the bleeding. Oh, well, guys, I'm not going to go into this because it's a little complicated. I mean, but like basically this is what I wanted you to understand. Like this part, I feel like, where was it? Okay, like 2-3 weeks ago before the test, there's a couple of you that came. A lot of you didn't, but a lot of you did come, and we talked about how, we talked a little bit further, and it's kind of hard, but if you understand like a little bit of what I'm talking about, then it will make it so much clearer when she explains it, because she is so amazing at teaching. So like she can say something like this complicated as this slide and make it so easy. And it's just talking about the vessel injury, but it's really complicated, and it's talking about like the different transmitters and all that stuff. But and there's like a couple slides on it too. So we're gonna stop here, but I would like to go over if you want to, I'd like to, where do I go? Stop share. I would like to go over where is it? It's the blood worksheet. Do you know what I'm talking about? I know probably none of you did, but it was pretty simple. So we can go over that a little bit, and I'll ask you questions. It's pretty simple, I'm not gonna lie. So for the most part, we can't answer all the questions, but we can answer most of them, okay? So let's go through it, all right? So I'm gonna ask you the question, because I know some of you probably don't have the and then you just answer whatever you think it is, okay? All right, so plasma is A, blood that has no red blood cells. B, the liquid portion of the blood, including clotting factors. C, the liquid portion of the blood after it's clotted. Or D, the proteins of the blood.
The liquid portion of blood, including clotting factors.
Which is B?
Yeah, it would be B. I'm pretty sure it would be B. I think so, because
That's sorry, that's a worksheet you created, or we have it available to us?
this is online. It's called Blood Unanswered. It's under, like, I think it's like week 6 or something.
Okay, I'll check now. Thanks.
Yeah. Okay. And then the next one is excessive destruction of erythrocytes. What are erythrocytes?
Red blood cells.
Perfect. Red blood cells. Excessive destruction of red blood cells or erythrocytes can result in A, thalassemia. Okay, I don't think it's that one because I don't even know what that is. Aplastic anemia, pernicious anemia, or hemolytic anemia. So let's walk through this. So thalassemia,
Hemolytic anemia.
it'd be hemolytic anemia. Just looking at the word, I know that it means that it's not good. But aplastic anemia means that it is like the bone marrow, right? The bone marrow is being destruction of bone marrow, which causes that the erythrocytes cannot be made. And pernicious anemia is the lack of B12. So that's what causes that it can't synthesize the red blood cells. And hemolytic anemia could only be the only rational answer that I would know. I mean, thalassemia, I don't even know what that means. Probably somebody could look it up, but I don't know what it means. All right. A hematocrit value of 80 is termed. So when we think about the values, right? Hematocrit is like normal between 12 and 18 for a female and like 14 to 20 for a male, something of the sort. So a hematocrit value of 80. Well, 80, I mean, does it mean 80%? I don't even know. That's kind of a poorly worded answer. But either way, what is it?
It's still elevated, so.
A, polycythemia, anemia, thrombocytopenia, or leukemia.
A, polycythemia.
Yep, polycythemia. And what does it cause?
What does it cause? What?
What does it cause?
Thick.
Yep.
Blood gets thick.
Yeah, thicker than a Snicker, right? All right, hypoxia induces the kidneys to produce A, platelets, B, intrinsic factor, C, orobrin, or D, erythropoietin.
D.
Yep, D, right? That erythropoietin is stimulated or produced by the kidneys, and hypoxia basically causes the kidneys to release erythropoietin, which stimulates the proerythroblasts to basically form red blood cells. The next one, we kind of did talk about it, but the first phase of hemostasis, right? Hemostasis is the platelet formation, or basically like when the collagen, like if I cut my arm by accident, and then what would happen first when the collagen's exposed, okay? And that would be like vasoconstriction, okay? And it also can be called vascular spasm, right? And that's one of the answers, but I'm not going to confuse you because I know none of it. Like, it's separate. So the first one's A, separation from globin and heme. B, activation of prosthrombokinase. C, platelet aggregation. Or D, vascular spasm. So it'd be D, vascular spasm. And because of basically that causes the blood vessels to vasoconstrict, which stops the bleeding or slows the bleeding, right? And you don't need to know all that because we haven't learned it yet. So you don't think I'm just saying that and getting in your mind so that when she talks about it tomorrow, you're not like, oh my gosh, what is that? This is such a new concept. It's going to be one of the things we're going to talk about tomorrow. Okay. So the next question is, which of the following activates platelets during hemostasis? Okay, so platelets, so you don't need to know what hemostasis, but let's think about this, that activates platelets. So active platelets production, okay, so A, erythrophil degranulation, exposed fiber, collagen, or endothelial basement membrane, what the hell? Anyways, fibrin thread formation, or thromboplastin. So if we go back in our slide, right? We go back in the slides. Now, I get, like, what it's asking is a little questionable because I know that what assists in platelet production is thromboplastin, right? But when we're talking about what activates platelets during hemostasis, or like hemostasis, I'm pretty sure it would be the exposed collagen, right? Because the first step is, right, it constricts the blood vessels, that's a vascular spasm, and then the platelet plugs go and plug it, and then that's caused by the exposed collagen. And then after that, the fibrin thread formation is formed. So, I mean, we're not going to answer that. But there's some that we're going to go back to, like, in later dates. And I skipped some, so because there's just no way that you guys know that or I know that. All right. But this one we do know. An individual with B positive blood, which has following antibodies in their, has which of the following antibodies in their blood? A, anti-A and anti-O. B, anti-B, C, anti-RH, D, anti-A, or E, none of the above?
Anti-A.
Perfect. So anti-A antibodies. All right. Now, next question. This one is not a multiple choice, okay? So it's a fill in the blank. So first is, what is hematocrit?
Is it the amount of red blood cells a person have in their body?
Yeah, the percentage yeah. So it's basically the amount of red blood cells, right? A part of the entire, like, blood, right? When you're talking about plasma to red blood cell, that kind of, when you're talking about that, right? And so what is normal hematocrit for a woman? Approximately. You don't have to give me, like, the exact number.
Like within 40s? Like
36.
Yep, it's about 36 to 46%. And for men?
Like 50s and 60s, right?
About 41 to 53%.
Oh, okay.
That's not too.
Where sorry to cut you guys off. I can find it, the worksheet though.
Okay, I'll look.
You say week 6. I don't see it on week
It's
6.
41 to 53.
I don't know exactly what.
It's week 7.
Week
It
6.
says blunt unanswered, doc.
Yeah, it's week 7.
Okay. The one that say PowerPoint?
No, it just says
Blood
blood
unanswered doc. Okay, I see it. Thanks.
No problem. All right. So, under what conditions does hematocrit increase? Right? What condition? There's like 4 I'm looking for. All right. So first one, blood loss. Right? That would make more red blood cells because it's trying to. Hi, Joy. She growled at me. She wants to go to bed. Anyways, blood loss, high elevation, right? When you go into high elevation, you don't have the air is thinner, or like there's just less oxygen in the air. So your body will overcompensate by producing more red blood cells. Lung disease is the same way, right? And so is exercise. Okay, strenuous exercise. Now, a decrease in hematocrit is indicative of what? You guys got it? There's 3 kinds. There's anemia, right? There's iron deficiency anemia, there's aplastic anemia, and there's pernicious anemia. Because if you don't have the right materials to formulate red blood cells, that would be there would be less red blood cells, right? There would be like less than normal. You know what I'm saying? And that's why you have you're sluggish, you're tired because you're not getting that oxygen to the rest of your body, and you're weak, right? Okay, so that was the end of that question. I did not look at her answers, so I mean I could be totally wrong, but I'm pretty sure it's like that. I just went off of PowerPoint. That's all I did. So it's not like I got things from other places. All right, define erythropoiesis.
That is the production of red blood cells.
Red blood cell.
Perfect. Yes, exactly. What factors increase or decrease erythropoiesis? So it's basically saying the exact same thing as the question before, because it's the same thing, right?
Yeah.
So it's just saying exercise, lung disease, high elevation, and blood loss. A decrease could be from lack of iron or lack of B12 or chemotherapy, right? Lymphoid and bone marrow production or function and production of, so it says by what mechanism. So I said lymphoid tissue and bone marrow or myeloid tissue because they function in production of the red blood cells, but I don't know exactly what she meant there. By what mechanisms? I mean, what mechanisms what stimulates red blood cells forming, production? We talked about it.
Hemoglobin?
Well, that is what it's made of, but it's secreted it's produced by the kidneys.
Erythropoietin or something like that.
Erythropoietin, or whatever the heck how you ever say it, and that's made by the kidneys, and it's secreted in response to what?
Hypoxia.
So I don't know exactly if that's what it means, but that's what stimulates production of red blood cells. I tried. Okay. All right, what are the causes of the following? Nutritional anemia is first, so let's talk about that. What is nutritional anemia? I think is talking about iron deficiency.
Low red blood cell, no?
Low iron. So
Go on.
iron is a component of hemoglobin, and hemoglobin is what makes up red blood cells. So without the iron, right, it doesn't, that leads to anemia because it can't function, like they can't produce red blood cells without that iron, because iron binds the oxygen to carry it through the blood. Because iron has a positive 2 charge and oxygen has a negative 2 charge. So that's what it binds and takes it from one place to the other. Got me? All right. Pernicious anemia.
B12 deficiency.
Yes,
Intrinsic factor.
yes, ma'am. Perfect. Sickle cell anemia. Talked about this a little bit. Okay, so sickle cell anemia is genetic for the first, and it is the malformation of the red blood cells hemoglobin and make the cells hard. So she might talk about it later on, but that's basically what it's about. Okay, so right here. What is the effect? This is basically, it's asking the same exact thing as we asked before. I don't know why she asked the same question so many times. I'm guessing because it's going to be on the test. That's like my best guess. So what is the effect of exercise on the effective blood volume? That is which circulation and hematocrit. What change? Okay, so that's the first question. What do you think? And strenuous exercise increases what?
The red blood cell production.
Yes, it does. Perfect. And what changes occur in the blood when a person travels from a low altitude to a high altitude? So it's basically the same thing. It's the elevation of, it increases the red blood cells in the circulatory system because it overcompensates for the lack of oxygen that it's getting. Because at a higher altitude, there's less pressure, there's like less, there's less oxygen because you're higher up. That's why a lot of people who, like, have you seen like Mount Everest, the people who travel at Mount Everest and they have to stop for like long periods of time to adjust to the amount of oxygen in the air before it goes to the next part. Got me? I don't know if that helps, but if it does, that's great. And then that's kind of where I want, what feedback? Okay, so this is something we know. What feedback mechanism regulates the formation of new red blood cells?
Negative.
Yeah, negative feedback mechanism, right? And it's a function of homeostasis to maintain the right amount of, to basically, you got what I mean. Like homeostasis is just like a broad term. Yeah. It's a negative feedback. And why do red blood cells have a short lifespan?
They
If you
don't.
produce it every day, I don't know.
They don't have a nucleus, and
Yeah, they don't have a nucleus, so they can't divide themselves. And plus, they get beat up a lot, which you can kind of think about because they get battered against the walls at such high pressures, right? Because they just go boom, 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 boom. So you can imagine that they get beat up, or like, I don't know. That just sounds painful. Just like, but they're not. I mean, I don't know. But like, it just sounds painful, right? To get like slammed. Well, to get, you know what I mean. Okay. All right. So you can get that. They don't have nuclei, so they can't perform mitotic division, and that way. So they kind of, and they also get beat up. All right. So that is pretty much where I want to stop, because everything else after this is kind of like stuff we haven't gone over. So there we go. We did a good portion.
Okay.
Okay. Everyone's so quiet. It's because I'm loud, I know. Sorry. All right. Well, is there anything anybody has any questions about or anything?
no, I think we're good. Well, I'm good.
No, you mentioned something about negative feedback. Can you mention what that do again? Both of them?
Okay, and yes, I will probably. Somebody asked. I'll probably get this recording. It'll probably be done maybe by the end of this. Like it might be up like right after I click end, and it might be up tomorrow. So I'll look for it. But like I said before, the positive feedback is basically when it's like it's kind of hard to explain, but in this function of like, let's just say contraction. So when you're talking about a baby, oxytocin is basically sent, and then it continues to keep going, right, and keep sending back oxytocin and more to cause bigger and bigger contractions, and it makes it bigger and bigger until the final thing is, the baby is pushed out of the uterus into the vaginal canal, out, and all that stuff. So that's kind of an example of positive feedback. A negative feedback thing is basically that let's just say I'm hungry, okay, and I eat, right? When I eat, I'm not going to keep eating, right? I'm going to stop, okay? So that's kind of a function of negative feedback, because once you eat, you stop. Okay, the same thing with this. It's not going to continue to make red blood cells if it doesn't need them. So it's going to keep going, and then it's going to be like, okay, we're good, we have enough, and then it's going to stop. Do you get what I mean? Like, one doesn't stop until, like, it just keeps going, and then one stops when it realizes that the thing is achieved. Like, there's enough red blood cells. I'm not hungry anymore. When, and then the other one, it basically keeps going, and it keeps doing it over and over again. It's not like oxytocin just keeps coming and coming and coming and making bigger and bigger contractions until you have the baby. It's kind of complicated, Jackson. I don't know. I don't even know.
No, that's fine. I already have an idea of what you're saying, but thank you though.
I tried.
No, you're good. I'm good now.
And you can always ask the teacher. She'll probably say, I hope I can answer, and then she'll answer it pretty well. So she probably knows a lot better than I do. But does anybody have any other questions? No? Yes? No? No?
No.
Well, thank you, everyone. I mean, I don't, do you guys want to go? Like, I don't know. We never end this early. I don't think I've never ended this early once. But if anybody has any questions, you can hang back if you want to ask me privately, but we're good for now. I don't want to go too far ahead, because I feel like if I tell you the wrong information, then you might get messed up. So
Yep. Thank you.
you're welcome.
Thank you very much.
Thank you. Bye.
Bye.
All right, good night.
Good night.